Let's talk about neuropsychopharmacology. It's a big fancy word that pretty much means how drugs affect your brain and your behavior. So we know that neuroscience means the study of brain and nervous system, right? Anything neuro is related to brain, if you will. And we should know that psychology is the study of behavior. So if the word psycho is in there, it has to be related to behavior of some kind. And pharmacology, our first terminology, is a study of how drugs act on living organisms. How do drugs have their effects on living organisms? So now we have some terminology that combines these words. So neuropharmacology is a study of how drugs affect the nervous system. Okay, for instance, how does caffeine make you jittery? Okay, it's directly affecting your body and the nervous system. Psychopharmacology is how drugs affect your behavior. And usually when we talk about behavior, we include mood, thoughts, and overall behavior. So there's the drug part, there's the behavior part, psychopharmacology. Neuropsychopharmacology is a combination of these three things. How do drugs affect the nervous systems and then go about altering behavior? Okay, so it's a big fancy word, but if you break it down, you can understand what it means. Now some other terms we're going to get into. Something called bioavailability. Now, whenever we take any drug, and if you think of a prescription drug that is perhaps designed by a pharmaceutical company, they're trying to see how much of the drug can actually get to the target site. Okay, so they have an idea where the drug is supposed to go and interact. We have to figure out how it gets there and how much of the drug is still active by the time it gets there. So bioavailability is the amount of the drug in the blood that is free to bind at the target sites or to go and do the job we hope it will do. A pharmacokinetic effect, okay, are any of the dynamic factors that get in the way or advance bioavailability. Okay, it could be as simple as the notion of when you drink alcohol on an empty stomach, you will, get inebriated a little quicker. If you have a full stomach, that will be a pharmacokinetic effect that affects the bioavailability of alcohol getting to the source that gets you a little tipsy. Okay, so there are many factors that can contribute to bioavailability, and so any of those are called a pharmacokinetic effect. Finally, we have to talk about the placebo effect. Now, if you took Intro to Psychology, I'm pretty sure they covered placebo effect. This is where a drug, just by name, can create physiological and behavioral effects, even without any true pharmacology associated with it. So just the thought of you taking a drug will alter your behavior and could actually alter your neural condition. It can change the movement of neurotransmitters. So a placebo effect is very powerful. This is why we have to use it as a control when we're doing any drug studies, because it's true. If you give a patient a drug and you say, hey, this is going to make you feel better, and you are a credible source, they just might feel better. And studies have shown that if you give someone a drug and it costs more, so if you give them a $1 drug and a $10 drug, of course, none of these drugs actually do anything. The $10 drug patients will say the $10 drug was more effective. That's the placebo